Right, a warm welcome from Geneva, Switzerland. I'm here with Charlotte and Boo, and you're seeing her live and on screen as opposed to the photo we've been using for years. I don't think you've aged very much, Charlotte. You look, if I compare it to the picture, I don't know how many years have gone by, and I know this is a sensitive topic that is also gender specific. So but of course,
it's okay, Reda. That photo was taken about 6 years ago. So
okay, and we celebrated on Monday the 5th work anniversary of Charlotte and at the Geneva Learning Foundation. So even though the applause here is to start the session, it's also, Charlotte, to wish you a happy 5th anniversary at the Geneva Learning Foundation and Happy New Year for those of you who are joining us today. Today's a consultation really focused on debriefing from the pilot survey that we're getting ready to launch with Grand Challenges Canada. Teach to Reach leaders were the first to actually pilot the survey. And I'm now going to hand it over to Charlotte to take us through the different slides to walk us through the process. Just as a reminder, this was of course part of Teach to Reach 11, peer learning by and for people who work for health. And Charlotte's going to tell you what you can do, how this podcast can help you if you have poor connectivity.
Thank you so much, Reda. And I just want to join my voice to yours to wish a happy and prosperous new year to everyone that is connected to today's special consultation. And as you said, if connectivity is not on your side, you have the opportunity to follow us on audio only using our podcast, and the link is going to be shared with you on the chat. So I think we are going to move forward with the slides because we have just about 45 minutes for this consultation, Reda. And as you said earlier, this is really a consultation with those that were invited to pilot this survey that we are doing in partnership with Grand Challenges Canada. And as you know, all of our sessions are usually very interactive. So if you want to speak, please type your message in the chat, raise your hand, check your audio devices, and unmute your microphone when you're invited to do so. Next slide, please. All right, so as I said earlier, this survey is launched in partnership with Grand Challenges Canada, and what they had to say about this is that at Grand Challenges Canada, we are committed to learning from those who are on the front lines of health crisis. With support from the global technology company ARM and the government of Canada, we are partnering with the TGLF to ensure that the insights and lived experiences of local health community guide our search for innovations that are tailored to the unique challenges of climate-driven health crisis. And we know that you are better placed, you that are in direct contact with communities are better placed to bring out these insights. Next slide. So I would like to turn towards our partner from Grand Challenges Canada, Dr. Joanna Sanchez, who is here with us on the panel to just give us some updates on what is happening as far as this survey is concerned. Joanna, are you able to speak? And I know it's early in the morning for you.
Yeah, it's not too early. I'm usually up by this time anyways. Good afternoon, everyone. Good morning, good evening, wherever you are in the world. I'd like to first thank you all for being participants in the pilot of the survey. Oh, that's quite close. Let me move back. I represent GCC. I'm the Climate and Health Lead at the organization. And essentially now we are given your input on your involvement in the pilot phase, we're now ready to move on to the full launch next week. So we'll be launching the survey to the rest of the network, as well as our own network and partner networks all around the world. We have funding institutions. We have multilateral banks and multilateral organizations such as the WHO and several other major organizations who will also be sharing the survey within their networks. And so you were the first of hopefully thousands that have completed the survey. And so we're very thankful for that. But we're very excited to hear what those at the front lines of this challenge are thinking, are hearing, what the perceptions are, what the ideas are, and hopefully it will inform research, policy, funding, that we can work together globally on solutions. And so January 15th is the full launch, and it'll be open for 6 weeks. And I'm sure there will be more communication from the Geneva Learning Foundation with your network about that as well. So thank you very much again.
Thank you so much, Joanna. I have just a quick question for you. In how many languages is this survey going to be available?
So far, it's going to be available in, of course, English, French, but we're also we've translated to Latin American Spanish, Brazilian Portuguese. We're translating into Arabic and modified Chinese. And if any of our partners who are sharing within their networks reach out and ask us for an additional language, given the size of their network, then we will consider adding. But so far, those are the languages that we are launching with next week.
Okay, thank you so much, Joanna. That is just to say, if you have colleagues and friends that speak other languages, any of these languages other than the English language, they have the opportunity of taking the survey as well. We are going to go ahead with our slides. And so we launched this pilot survey on the 11th of December. That was a little under a week after Teach to Reach 11. And it was closed on the 22nd of December. And it was sent out to those we considered as guests of honor at Teach to Reach 11. That is, you answered the Teach to Reach questions prior to Teach to Reach. So we have the numbers on the screen: 822 English and 702 French. And we got 306 responses. So okay, so right now, just to tell you what we asked you in this survey and why. So this survey was focused on 3 main topics. The first was we were inviting you to tell us what climate changes you see in your communities. What are the observations that you are making? Earlier on, we had Dr. Tusime Ramadan of Uganda talk about more floods, longer dry seasons, or higher temperatures. And then we asked you to share how these changes affect the health of the communities that you serve. For example, if the flooding could lead to more waterborne diseases. And then lastly, we're asking you to explain what makes it hard. So what are the barriers? What makes it hard for you to protect people's health when the climate changes? So it could have been lack of tools, resources, or whatever. So, and I'm glad to see that in the chat, some of you indicating that you completed the survey as well as the New Year wishes. Next slide, Reda. So these are the kind of choices that you had to pick out from, especially focusing on the last 2 years. So on the last 2 years, which observations did you make? And then what are the health problems that the communities are facing? And then the barriers. What is stopping you from being able to take action to support your community as far as their health is concerned? And as I indicated earlier, it is important your responses to this survey matters because it will help Grand Challenges Canada and their partners to create a new funding for local solutions. And it's also an opportunity to know what support your communities need the most. And for each topic, we ask you to select the top 3 and then the most important ones so that these interventions can be prioritized. And then all questions are really focused around your own personal experience, the experiences of your communities. So there are no wrong answers. Whatever you share will be very useful and very important for us.
Okay, Charlotte.
So next slide.
Yeah, we
Yes, Reda.
are trying to get John Wagai. So he's the survey statistician who's already, of course, working on developing the survey analysis. We're trying to get him into the panel.
John has joined the.
Okay, wonderful.
He has joined the panel.
Okay, great. All right, John, a warm welcome to you. And we thought it'd be great to ask you to introduce yourself to the Teach to Reach, to this community of health leaders from Teach to Reach. They were our guests of honor in December because they had already shared their experiences, many of them around extreme weather events, for example, and other topics. Could you kindly introduce yourself?
Yeah, thank you, Reda. So my name is John Wagai, and I'm a statistician, epidemiologist who is supporting the analysis of this data. So I'm working with Teach to Reach for looking at basically the data behind this, and I hope I will be sharing some of the results and some of the findings that we are observing. And thank you so much for participating in the service. Thank you, and over.
Thanks, John. And very quickly, do you have? So we hesitated about how to do this, how to best do this. So right now, you've already gone ahead and done a sort of preliminary analysis with a subset of the pilot survey results. Do you have something you'd like to share, or would you prefer to hold back until we have some more definitive results? And then we'll certainly be inviting these leaders, this community from Teach to Reach, to get the sort of first look at the results. But what's the situation right now?
I think it's important just to see what kind of data is coming. It's coming, even though this is really preliminary.
Yep.
We just finalizing merging the data from French and English, so I can present just a few findings from part of the data, and this will show us what kind of information we expect.
Okay, great.
Over.
You should be able to share your own screen. Let me know if you have any problems with that. Great.
Okay, so can you see my screen?
Yes.
Yes.
Okay. So basically, this is again, I said we've just completed just a few minutes ago, and getting the data, merging the data from French and English teams, the whole 306 records of them. But this is analysis that's a little bit older. So we downloaded this data some time back, and what you're doing is just looking at some of the background characteristics. What organizations do you work for? For example, and this is based on 100 participants. We will be sharing the full set from the 306 respondents who responded to the survey, pilot survey. And you can see the distribution. We have the largest number of people here are working for NGOs, for example, and that's 39%. And then there is another group that comes from the Ministry of Health. Then we asked a question about the population. So what we did is we took that and grouped it into three. Whether you're working in an area with less than 100,000, 100,000 to 500,000, and so on. And you can see most of the people who are working in areas with a large population of more than 500,000. Then, in terms of the years of experience, for most of the people who responded to this questionnaire had more than 10 years, worked for more than 10 years. And then we also looked at the roles, and then we looked at which level you work on. And then, for example, the countries that responded, and these are Anglophone, the people who responded to the English version of the questionnaire. So majority of them from Nigeria, that's 56%. And then Uganda, Ethiopia, Kenya, and India, and all the other countries. Then we also looked at exactly where you work from. And this was a free text, so you.
And John, there is a request if you could increase the font size or share just a proportion of the screen that's showing data. I think that would help. Yeah. Okay, thank you.
Okay. Then we also looked at the genders and the areas where they're living. So once we did the first level of background characteristics, the second part was to get this by different parameters. So looked at the organization, and we disaggregated that by gender. We also disaggregated by whether or not you worry about climate change. And then we looked at also, for example, which areas you live in. Again, some of these numbers are preliminary. We are dealing with a small data set of just 100, and the proportions might be a little bit misleading, but I think what this does is to help us to see what is in store and what's available, what you should expect in the final pilot report. Then the other thing we looked at was went into some of the other characteristics that we responded to. So, for example, in the last 10 years, which health problem do you think will get worse? And yeah, from that small sample, most of the people think that mental health issues, anxiety and depression will be worse in the next few years. Then there'll also be issues with malnutrition, uh, and then illnesses from bad food, but also illnesses from bad water such as cholera and diarrhea. So that was the first disaggregation. The second one was about uh, in the last 2 years, which health problems do you think have worsened, and because of climate change or climate related events, and then again, diseases like malaria and dengue fever. Majority of the respondents responded to that. And you can see that varies. So the responses will vary based on which country the respondent is in, and also the region where they come from. If it's Africa or the Afro region, if it's the Americans, and so on. So that's the first part of the analysis, and basically this analysis shows different tables with crosstabs of the different responses that you gave. The second part of the analysis is to do the Likert questions, and the Likert questions. The best way to look at them is to look at them in a graphical manner, and so I've just provided a few of these graphs. So I don't know whether this screen is visible. Huh?
Yes, it is. Yep.
Okay. Yeah. So this for example is climate change a threat to the health of people? And you can see just by a glance that majority of the people say they strongly agree that climate change is a threat. And you disaggregate, once this is disaggregated by different uh, the different organizations that they work from, you can see how that distributes. But a caution or caveat when looking at this is still pilot. Some of these categories may just have a few people, maybe less than 5 people, and for that reason, this is not conclusive. Then we have other. You can look at the same question uh, by different category. The same question by the years of experience, and here you can see, regardless of how many years somebody has worked or years of experience, the there's a lot of concordance in terms of how they think climate change has affected is a threat to the health of people. So this is just a sneak preview of what you'll be sharing. We hope to finalize the analysis in the coming days, and we will provide this the final analysis of the pilot. So thank you so much for your attention, and over to.
Thank you very much indeed, John Wagai. And you know why we are sharing this with you at this stage is with Grand Challenges Canada too. We share the same commitment. If we ask you questions, if we ask you for information, if we ask you to share your experience, our commitment at the Geneva Learning Foundation is to give back and to make sure you are closely involved in the process that is ultimately about you and the communities that you serve. So we've had some great comments. Just want to share a few of them. There was, let me see. Won't be able to share. So Lillian Mutua from Nairobi City County. So that was a general happy new year, because this is the first time we're meeting with the Teach to Reach community this year. Amina Umar from Bauchi State, Nigeria. Stephen from Juba, South Sudan. Wendy Seteng Asefa, Cluster Coordinator for Malaria Vaccine Introduction. Esther Yakubu, also with greetings, thought that the survey was an interesting one. Esther, we're going to turn to you so you can tell us what you found was interesting, and also if there are any points that we can improve. Sabatu Elizabeth Danlandi, I think this is really for John, my guy, who says, I love Likert analysis. This interests me so much. Ernestine from Ghana. Claudia Sembuya from Kenya. Raled Musa joining from Taraba State, Nigeria. Bubakar Aminu from Zamfara State. And Charlotte has already gone ahead and shared the two questions. We're now going to deep dive into the consultation. So this is now over to you. You know that every activity, every event is that we do is participatory, which means you need to be involved. We do have 3 questions. Why were you unable to complete the survey? We got some responses. Some of you told us and then said you would attend today. So if that's you, please raise your hand so we can go to you and hear really firsthand. Tell us what the challenge was. It could be something you have control over. It could be something completely different. The second question is just more generally, what was your experience taking the survey? And then the third question is really asking for how we can improve the survey. Can you think of one change to get very specific? And so those are the 3 questions that Auntie Charlotte will be leading us through. Over to you.
Thank you so much, Reda. And while, as Reda said, please go ahead and raise your hand. And I see a comment from Ibrahim Lawan in the chat. Ibrahim, if you can specify, what was your experience with taking the survey, and if there is one change you would like to make this survey better, what would that be? We really want to hear from you. But I'll go straight to Mahesh. Okay. Mahesh, your hand is raised. Are you able to unmute yourself? Okay. And please do start by introducing yourself.
Yeah. Hi, everyone. Good morning, good afternoon, and good evening, based on your location around the globe. It's nice to be here. Happy Happy New Year to all of you. And I hope you are doing well and you enjoyed your vacations well. So anyway, I completed that survey and I found it very interesting and enjoyable as well. As far as one thing that I would like to have in that survey was that if there would have been a writing something about the experiences in 250 words or like that, or 120 words or 150 words, whatever that is suitable for that survey. So it would have given a better picture, because there were a lot of things which were not included in specifically there. So from my point of view, it would have been better that if there would have been a space for writing the specific experiences which are not covered in that survey particularly. So that is from my side. And as far as the survey was very enjoyable and it was informative, quite informative. Thank you.
Thank you so much, Thank you so much, Mahesh Bhatt. And I know Ibrahim Lawan. So I'm going to turn towards you before going towards Lilian Muchua, thinking about our rules of fairness and equity. But since I invited you earlier on to speak, Ibrahim Lawan, can we hear from you? And thank you, Mahesh. We have listened to you. Probably I'll turn towards Reda and Joanna later on to comment on your feedback on what you have shared. So Ibrahim, are you able to unmute yourself? Okay, over to you.
Okay, thank you very much, and I really appreciate. I'm very sorry I'm in a working environment. You can hear more sounds, but bear with me. So actually, the survey is very important. I have filled it, and as to add, one thing that I would like to suggest is a potential improvement to enhance the survey effectiveness in capturing climate health risks and barriers could be the inclusion of like more contextual questions related to local climate, related to hazards and other health impacts. For example, now adding questions about the frequency and severity of extreme weather events such as flood, drought, or heat waves, and how these events affect healthcare delivery and community health outcome in many regions. Though I have seen some of these, but like making an improvement will help in the survey. This will provide more like insight into the climate health challenges we face, and it will help to like target a potential solution. So thank you very much.
Thank you so much, Ibrahim Lawan. Though we had a bit of trouble really hearing you clearly, so I'm just going to invite you if you can type what you shared in the chat, just a brief summary, that will really be helpful. So I'm going to turn directly now to Lilian. Lilian Mutua, are you able to unmute yourself? And Happy New Year to you, Lilian. And please do introduce yourself as well.
Thank you. Happy New Year to all of you. My name is Lilian Mutua. I head the Health Promotion Department for Nairobi City County. Nairobi is the capital city of Kenya. I'm glad to have participated in this survey, though for me it was very limiting because when we look at climate change, I wish in future we also address thematic areas. For example, I was interested in talking about the floods. We had very heavy floods in Nairobi County, and it was not only about health. We had destruction of environment. We had inaccessibility to health services, both for access and utilization. We had disruption of special clinics, for example, the antenatal clinics, the child welfare clinic, and any other special clinic. And where the floods occurred, people even lost their medication documents. We also, when we are looking at environment, we know we've tried to restore, especially the drainages. We also had demolition of houses where where people had built across the river banks. So when we look at this, we also see that there was a lot of food insecurity among the people who were affected by the floods. And there was also sexual and gender-based violence. And it was a difficult time. So for me, I would say that when we're addressing these issues, we look at different thematic areas so that we only do not address health, because any thematic areas that has an issue, it always falls back to health. We had issues of mental issues. The first responders at the ground are the community themselves. We didn't have a very clear picture on what to write about that because of the limitation of space. So we should look at the structures from the community, right from the household, what is happening, up to the policy makers. Because even the aid that was coming to the people during the floods was a bit too late, and also the way the alarms were being raised, because people were notified of the floods earlier on. But when the flood came, they just came in and at an instant. So we must look at who takes what role for as a responder, and also strengthen the community response. Thank you, and over to you.
Thank you so much, Liliane Mutua. I see we have Marion Mutange. Your mic is unmuted. Are you able to speak? And please do not forget to introduce yourself. If not, Marion Tijani Suleiman, and then Esther Yakubu.
Okay. Good morning and good afternoon to you. I'm Tijani Suleiman, a public health specialist from Zamfara State, Nigeria. Happy New Year to you all. I'm really happy the time that I saw the survey regarding the climate change. It makes me happy because I work in the community. So seeing that survey in regard to the climate change, it helped me to recall those risks and challenges I face, and I see the community are facing in regard to the climate change. So the most important aspect of it is that there is a lot of things that need to be included, but due to the limitation of the words that you need to speak a word, so we are unable to put all those aspects. But the survey is far better and it is at the right time. And also, we hope that this survey will help in future research and the collaboration, because our community are facing a lot of challenges, which I already shared with you in the survey. So what I will add is that next time if you are making a survey like this, please make it in a broader term, so that will be able to put all what we learn in our community or what we see as a risk and barrier regarding to the climate change that will affect the health of the community and the population at large. Thank you. I'm over.
Thank you so much for that feedback, Tijani Suleiman. Esther, over to you.
Good morning, good afternoon, good evening. Nice to meet you, Sophia Kubu. I work with Health and Development Support Program based in Jos Plateau State, Nigeria. Well, I tend to agree with the first speaker that she's encouraging that when carrying another survey, we shouldn't just stick on health alone, though we know health is wealth. And the most important thing, what the climatic changes does to one health. But if we look at other climatic areas like education, just to give an example with one of the community I visited, and because of the flooding, the school is no more in section. Why? Because all the children don't have class to stay. The flood has destroyed all the classes, and instead of going to school to learn to be better people tomorrow, they are all at home. So I think when we are talking about climatic change, we should look at that area also, and the social well-being of people. You know, especially where the flooding and the heavy rainfall, we can see that there will be disconnection in electrical equipment and all that. So these are some of the things we should look into, and going deep into the health, because the water carries a lot of microorganisms along from one end to the other, which could affect health in general. So I think the survey is very good, and will encourage that let it have a more wider scope than just limited to health. That could go a long way in impacting the life of human in every area of life. Thank you, and up.
Thank you, Esther Yakubu, for sharing that. And I want to, maybe before turning towards Joanna and Reda, I would like to listen to one last person. That is Sabatu, Elizabeth, Dan Ladzi. Johanna has been raised for a while. Elizabeth, are you able to unmute? Okay. Over to you, and introduce yourself.
All right. Can you hear me all?
Yes, loud and clear.
Thank you for this opportunity, Reda and Charlotte, meeting you here again after the first session on the RCA. I'm glad that I'm here. I am Sabatu Elizabeth Aladi, the founder and CEO, African Hope for Community Progress Initiative in Nigeria, with headquarters in Bauchi State. Yes, the survey, I participated in the survey, I answered all the questions. It was so interesting because it dealt with the real health impact of the climate change. And some of these things, we are already working on it. It's things that we've been doing in the community. Like me, I have some communities using my funds in my organization will be implementing. The issues are clear, and most of them are exactly what is happening. The areas I want to highlight for improvement is that some of the key area outside health that this survey was supposed to look at it is the issue of food security, which also linked with health because of malnutrition. In the communities where we work, AfriHub work, we have flooding. It wears away farmlands. It wears away crops. Last year, 2024, most of farmers couldn't now, they're facing a lot of challenges, difficulty to feed because the farmlands are washed away by flood and the food crops are washed away. Now, a measure of corn is very expensive here in Bauchi State as a result of flooding. And this poses a threat to nutrition of the children and pregnant women. This issue also as well what we call gender-based concerns. Because if there's no food at home, there's gender-based violence issues, domestic violence, gender issues. Men will be harassing women, women will be harassing men in their homes. And which sometimes affect marriages, bring a lot of issues, including divorce. And also it leads to child abuse issues. They carry the children now to force them to go and sell and bring something to feed the house. So I wanted to put these things, but there's no space. So next time, add space where we can express this kind of things. This is what is happening in community here in Northern Nigeria, or especially Bauchi State, in the LGS faced by flooding. The children are now they're not going to school, they're busy selling to get little money to bring to the family. So these are the things we need to further research need to do in other areas aside health. Thank you.
Thank you so much, Sabatu, Elizabeth. And I know so many people had their hands raised and have not been able to speak. Please, you can also leave your responses in the chat. We have less than 10 minutes left for this session, and I really want us to listen to Dr. Joanna Sanchez. She has been listening, I'm sure, attentively to your comments and your feedback, and I am sure that she surely has something to share with you with regards to that. And please also go ahead, you can continue to share your feedback in the chat, and I want to recognize all those who have been doing so: Dr. Tusime Ramadan, Nduka Ozo, and all of the others that have been sharing their comments and their feedback in the chat. Joanna, are you able to unmute yourself?
Hi again. I just noticed, though, that there was a comment from Mohammed Quresh who said that he would really like the opportunity to speak. I don't know if maybe we give him the opportunity first. I'd be happy to let him speak first.
Okay. So, Mohammed, you are able to unmute yourself. So please go ahead.
Thank you. Good evening. Thank you very much and giving me the time. Really, frankly speaking, I appreciate the survey, and it really it was very good. Really, the question and all this. Actually, I'm from Ethiopia, particularly. We have tripolar like Kenya, Somalia, Ethiopia, the Horn of Africa, were most fragile. So I could appreciate if in the future we could, enhance the questionnaire, like the issue of, we talk of, environmental, social, and economically, how it has been affected. This, as flooding, destroy a lot of things, a lot of houses, a lot of crash, a lot of cat. And in that scenario, if you could, add something, because really it is touching me, and I really like this climate change, being that I'm the field coordinator of an organization working, especially this climate issue right now in Ethiopia, is something that really touching us. And also, if the question also could be, in something like One Health approach, also could have been good and more on livelihood, as I already mentioned, the economically. Given, I could have talked a lot, but let me give the time others. Thank you, Charlotte. Over.
Thank you so much, Mohammed, and thank you for the concession. Joanna?
Hi again. Well, thank you so much, everyone, for your feedback. I have indeed been listening intently and making notes here that I'm sure we'll be discussing later on with the team here to see if there's any opportunities to make any modifications. But I guess one of the things I wanted to say was, because I heard the comment come up a few times about our focus on health. In fact, it is the central focus of health, but we can almost argue that almost everything impacts health, right? Even socioeconomic issues and flooding, for example, and any sort of disasters will always have an impact on socioeconomic status and those challenges, which will obviously then lead to impacts on health, access issues, and all that to health services, which we do capture in the survey, that the health services aspect. But the global health community is working very, very hard to center the human health experience as the face of climate change, in a way to enhance climate financing for health, for humans, for people, for those that are most vulnerable to the impacts of climate change, because it's actually been a little bit neglected. The focus has been more on mitigation, and which is absolutely important because we need to stop this crisis. But if we center human health as the biggest challenge from a climate perspective, then perhaps it'll inspire more action. And so those of us, as like myself as an epidemiologist, and those of us that work in the health sector, we're really trying to push that angle. And so this is why your insights are so important as the people who see what those health impacts are. So that was the reason for the focus of the survey. We are a global health organization, and all our partners are global health organizations, but we of course recognize all the secondary, and potentially that health is the secondary effect to a primary economic effect of climate change. So I just wanted to point that out, that's the reason for centering. We also made the decision to focus on human health for this survey, given, again, the interest of the partners. However, you'll notice that we do capture zoonotic diseases, and we do capture vector-borne diseases as some of the health challenges. We do hope that we could eventually move into a more One Health approach, where we are thinking about planetary health in general. Perhaps it could be a down the line in the future, we do an additional survey that potentially would capture that. But at this point, we made the decision to center on human health for that reason, just again to continue pushing climate and health financing. And we have a very large network of partners that have joined us on this, and we're trying to get the attention of those that have the biggest funds as well, and the researchers and all that. So that's been the reason for that. So I just wanted to clarify that. But thank you so much. I also noticed some comments about languages, and we are very open to translating into more languages, and we just have to have justification to our communications team as to that there will be enough people that would need this language, that wouldn't be able to use English or one of the other languages. So please do share with us if you feel that there is a very large community that would benefit from a specific language. And then we would be, I saw Swahili was mentioned. If there's anyone from on here from Asia, anywhere in Asia, and if there's any languages there that could be useful, please do let us know. The decisions that we've made so far have been based on partner needs and what the biggest network sizes are. If it's, for 100 people or a smaller group, it's harder to justify. However, we will consider all requests. So please do let us know if you have any language requests.
Okay, thank you so much, Joanna. Right now, I'd like to turn towards Reda. Reda, while the speakers were speaking, I saw you were going back and forth with the survey questions. Probably you're able to answer some of the questions and the concerns that were addressed, but also what are the next steps after this?
Yeah. So first of all, I think it'd be great if we could hear before we go, maybe from a couple more people. But one thing I wanted to respond to is at least towards the end of the survey. So maybe a problem because by that point you may be wishing to get it over with. There is a very open-ended option, and you've seen this before in TGLF questionnaires and surveys where we ask you, do you have a success story, a challenge that you need help with, a lesson learned? And if you say, so you can skip this, you can say, no, I don't have anything to share. But if you say you have a challenge, or you want to share a lesson learned, then you really have here as much space as you want to be able to answer. So I think this may be, but other than that, I think I'm listening intently as well, and I'm sure, Charlotte, you are too. But I think the most important thing is to hear maybe more voices before we go. We do have a very hard stop because we're starting the session with the Francophones in a few minutes. Back to you.
Thank you, Reda. So I'm turning towards Gifty. Gifty, you said you were not able to take the survey. So are you able to unmute yourself? Okay, great.
Hello. Hello, everyone. Please, am I audible?
Yes.
Okay. Thank you. Thank you for the opportunity, Ms. Charlotte and team. Yeah, so I was saying that I was not able to share my survey. I was not able to take part in it. But then if the survey can capture a part on we rendering health services to persons with disability, there should be a portion there where we could just chip in things, because on the ground, when we go into the communities, we all can attest to the fact that we talk about universal health coverage, but then when it comes to women and girls with disability, and even children under 5 years, sometimes giving them the same accessible and quality healthcare is not the same. Because, for example, if a child is in the room far away in a village suffering with disability, and because of his or her condition, and nobody even wants to get close to this child to even touch, because they think being a disabled child means that maybe it looks contagious. They don't even want to touch you to even attend to you, to give you your vaccines that are even due for immunization. Then how are we hoping that they all get into the same boat? So to me, it's a barrier. Yes. So if there could be a portion in the survey that could capture that. Then also about the language barrier about the sign language. We know we are advocating for that, but how many people do we have as interpreters at the hospitals or maybe even at the CHIPS compound levels? We have only few. And are they always available? No. So if there could be a portion maybe in the survey that could capture that, where those of us on the field that are in these activities could actually express our stories or to tell our stories, that would be very fine. Thank you.
Thank you so much, Gifty, for that. And if you can see on the screen, there is a whole list of barriers that we suggest in the survey, but there is also an option. The main barrier you face is not on the list. And as Reda said earlier, there is the opportunity to elaborate further on that. And also for those who were not able to take the survey, I'm thinking about Duka or Zor, that also indicated in the chat. Just know that once the survey is launched on the 15th of January, you will be able to take the survey, to complete the survey as well. I think we're going to have one last speaker for today, Ibrahim Yakubu. Are you able to unmute yourself and to speak to us now? Ibrahim Yakubu, I'm inviting you to unmute. Okay, Reda, probably Ibrahim is not able to speak. I'm seeing that we have just about 12 minutes before the start of the French session. I would like to turn towards you for next steps and final word.
Sure. Yeah. So first of all, really want to recognize and appreciate this amazing Teach to Reach leaders. You were guests of honors at Teach to Reach 11, but many of you have been contributing, participating, and hopefully also benefiting for many years. In some cases, since January 2021, the time of the very first Teach to Reach conference. Also want to thank and acknowledge a great partner, Grand Challenges Canada, and of course Joanna Sanchez and the rest of the folks at GCC. It's it's really for a global funder to take this initiative of taking extra time to listen and learn from practitioners on the ground. You heard Joanna explain why, and they're doing that. And I think there's a lot of goodwill from the global level, a keen understanding that things that matter happen at the community level. The question is, how do we get better at listening and learning and working with you and supporting you, making sure that everything that we do from that global level is really there to serve your needs first and foremost, and the needs of the communities that you serve. So this, just to clarify, may not have been obvious for some of you. You may have thought, well, this is the survey, this is the pilot. The data that you shared will be incorporated in the best ways possible with the main survey, but really where we'll be looking to you once we kick off. We officially do the global launch of the survey, and that's what Grand Challenges Canada is working on right now. Then, of course, we'll be asking you to share with your colleagues and to see how we can get as many people from the health community to respond to the survey, to give really everyone a voice and everyone a chance to contribute and to make those voices heard, so that the funding decisions, the policy decisions from the global level are really grounded in the people and areas and communities of greatest need. Thank you, Charlotte.
Thank you so much, Reda, and thanks again, everyone, for taking out the time to join us today. So we look forward to connecting with you again at the earliest possibility, but stay tuned to our social media handles and also your inboxes for everything we have in the pipeline. And we hope that once the survey is launched, you are going to disseminate it as much as possible to colleagues and friends and others that are working else, so that we can capture as much information as possible. Have a nice day and a great month and a great year 2025. Bye for now.
Sama na